nerve radiation, which is most commonly known like by a funny bone type sensation, that radiating burning pain that you get from the elbow after you hit it on the edge of a doorway or a counter or wherever. Very common similar type of problem that happens in the neck. However, it isn't as easy as you have some arthritis or some discs that are degenerative and you're getting a nerve that's impinged upon, and therefore that's the problem. It's much more complex than that. First of all, in the cervical spine, the joints are by far the controlling structural tissue and the one that are most injured and most affect nerves. As we lose our normal curve in the neck, now the normal curve in the neck actually is this way. So it's more like this. We're not supposed to have a straight neck. There's about 5 times greater pressure on the discs when your neck is straight. It's called military neck. And doing cervical curve restoration as part of a full healing program is extremely important. But understanding that using tissues to help pull that back into a normal curvature, combined with physical therapy, chiropractic, postural restoration, massage, strengthening, stabilization, it's very important to understand how to feather all of these things together. These are very elegant, very careful things to consider and put together for a patient. Can't be done in a short period of time and can't be done with a small number of injections if you understand how to assess the pathology correctly, which is something that we'll talk about a little further on in the website. So understanding that all these things are working together and it's not just a nerve being impinged, at the level of the spine that's important, we need to understand, if we're going to treat you successfully, that those nerves, after they come out of the neck, are going through fascial planes. That's planes that occur between your muscles and other surfaces, and then they're combining and changing to create your peripheral nerves through a part of the nervous structures called the brachial plexus. Very common for those fascial planes, for tight muscles, adhesions in those fascial planes and tight muscles, to create symptoms that are very similar to the ones that are coming right out of the neck. And in fact, those two things happen at the same time very often. Understanding which one's chicken, which one's egg, and how to treat them together is critical to long-term success. But then also understanding that there are certain ligaments and fascia that can also mimic nerve-like symptoms, and not everything that radiates that feels like a nerve is a nerve. So working with other practitioners, physical therapists, chiropractors, personal trainers, to elucidate exactly where the postural strength, stability, motion dysfunctions are, and creating a full plan is critical for long-term success. Just injecting around a single nerve, even though it might make it feel better for a time, on average 6 weeks for a cortisone injection, isn't sufficient for healing the tissues that are affecting that nerve and all of the tissues after that nerve comes from the spine. Very important to understand how they interrelate and combine to create symptoms.